if I could sit down and talk to the little girl who just got accepted into nursing school and was getting ready to start a new career, these are just some of the things that I would say to myself. Hi guys, and welcome back. For those of you who are new here, my name is DeAmber Monique. I am 29 years old and I've been a registered nurse for almost 4 years now. I have experience in pediatrics, medical oncology, med-surg, a little bit of hospice, strike nursing, travel nursing, and PACU. Thank you guys so much for the like, share, comments, and support that I receive on these videos. It actually means a lot to me, especially somebody who truly loves and enjoys their job. And I'm able to give advice to those that are looking to even start this career or, begin a new journey in their life. Today's video is really just me giving advice to you guys about nursing in general. Like, not just one specific topic, but just everything. Like, if I could sit down and talk to the little girl who just got accepted into nursing school and was getting ready to start a new career, these are just some of the things that I would say to myself. Nobody did this with me. And it's kind of funny, like when I became a nurse, I was a tech before, but I still kind of feel like I had no idea what I was getting myself into. So the first thing that I would tell myself is don't let a bad shift define you, and don't let it define the type of nurse that you are. I have had plenty of bad shifts. I've had plenty of shifts where I literally thought, like, is this job for me? Did I do the right thing? Should I have called this sooner? Should I have done X, Y, and Z? Or there's been plenty of shifts where I've run around like a chicken with my head cut up, and I felt bad for giving, night shift, whatever I couldn't finish. Remember, nursing is continuous care. Whatever you can't finish, night shift can do, and vice versa. Whatever night shift doesn't finish, day shift should be able to do. That doesn't mean leave a task list full of 20 things that need to be done. But sometimes some things truly cannot be done, even if you stay after. So don't allow things to make you feel like a bad nurse. Like, I'll give you guys an example. So I had a patient one time. We'll name him Quan, because I've never had a patient named Quan before. Quan went and had a procedure done. After Quan's procedure, he didn't feel the best. Per anesthesia, I'm thinking Quan is, just still getting over anesthesia. He's on a lot of heavy drugs, especially the next day, still getting his IV medication, everything. I'm communicating with the doctor like, hey, I don't think Quan is, a little bit back. He's not back to his baseline yet, and I'm concerned. Doctors in and out, we're titrating drugs, we're doing the whole nine. Quan ended up having a medical emergency that, I feel like if I would have caught that earlier, it would have had a different outcome. And I was really sad about it. Like, I literally went home and I cried about it the whole way home, because I was just like, I didn't do enough, whatever. Like, I wasn't, present. I didn't realize the signs and symptoms. And that literally was not the case. When I say I was in Quan's room, I worked 12 hours that day. I was in Quan's room maybe about at least 7 of those 12 hours, because he left the floor around 5 to go to higher care. So I was in there a lot, and it wasn't until, the family member was like, hey, this is actually very abnormal. And that's when I was like, let me take a look. And I was like, this is actually different from my assessment that I got this morning. So let me just go ahead and we're going to call this rapid, and we're going to go get imaging done ASAP. So I'm glad that family was at bedside, because, I tell family all the time, you guys know them best. That doesn't mean that you get to come in and, just tell me X, Y, and Z and tell me how to do my job. But I'm always going to refer back to you like, hey, is this normal, or is this their baseline, or what do you think? What do how do you tell me how you feel? And we can go from there. But yeah, after that shift, I literally felt like the worst nurse ever. And I just had to keep reminding myself, like, you did everything that you could do. And when the signs and symptoms were clear, you escalated it. You were in contact with the doctors all day. You were assessing this patient. You were in and out the room. But, you know, things just took a little bit longer to unravel. The doctor was literally in and out the room as well, and we couldn't figure it out. We just thought it was the medications that he was on, and it ended up being a medical emergency. But I didn't allow that shift to define me as a nurse. I actually grew from that situation. Like, now in my gut, when I feel like it's something, I'm calling a rapid. Like, that's it, that's all. We're calling a rapid because I would rather find out that it's nothing than to know that it's something. So yeah, that's just, you know, give yourself grace. And I have a hard time doing that. Grace will take you a very long way, especially in this profession. I never really was a boundaries person, but this is my second tip. Learn to set boundaries early. And I had to learn this in the career because I've always been so giving. I've always been there for everybody else. I'm always at work. So, you know, if you call me, I'll probably come in. But I've learned to set boundaries. I've learned to, you know, protect my peace and to really enjoy my off days. So when I first started nursing, I feel like I was at work all the time. I would work my 312s, and then there would be some shifts where they'll be like, oh, we need staff to stay over. Does anybody want to stay? And I'm like, yeah. Or the charge nurse knew that they could text me and ask me to come in, and I would come in. Or, you know, I'm always picking up those extra shifts. That started to burn me out, and I've learned to protect my boundaries. So now what I do is I pick up shifts that I want to pick up. When people text me asking me, do I want to come in? I will say no. Sorry, I have an itch. Even if I do want to go in, I still say no just because it helps protect that boundary. Like, sometimes I'm like, I have nothing to do. I'm sitting on this couch. I'm just relaxing. But you really need those type of days. So me saying no and not agreeing to do something every single time I'm asked has helped me protect my boundaries and help me protect my peace and my mental health, because this career can literally take it all from you. So just setting those boundaries early and, you know, accepting what you want to accept and not accepting what's not acceptable is very important in this career. Another tip is to get your finances in order early. I know that it's really, really hard, especially in this economy. Things are different, times are different, but it is super important. Those student loans are very real. A lot of people don't know about the PSLF loan forgiveness program. Pretty much how it works is you have to work for a nonprofit organization and you have to be on this plan for 10 years. Now, you can switch organizations. Like, if you work at one hospital, you go to another hospital. As long as they're nonprofit and as long as they qualify, you're fine. You just have to upload it every year. You have to upload the form every year, and you have to show your finances every year. Basically, what I also did was I got into a income-based driven repayment plan for my student loans so that I can make that. So for 10 years, I'll pay whatever they want me to pay for that year, every year. And then after the 10-year mark, whatever is left is normally erased by the government because I work for a nonprofit. So roughly right now, I have about $70K in federal student loans. If I do this program at how much I'm supposed to pay monthly, I'm only going to pay about $30K back, which is not bad at all. I regret not doing this sooner. I should have did this when I first was a new grad, but I didn't know about the program, and my student loans were still in default because I had ended up going back to school to start my master's. So I didn't know, and I was just lollygagging and chilling. But now that I know, I literally pass this information on to everybody. Yeah, just get your finances together. I know, like I said, it's hard, but those things will literally help you in the long run. And the more debt that you can pay off earlier in your career, the less you will feel like you're working harder towards the end of it to continue to pay off this debt. I'll tell you guys, I've been nursing for 4 years. I bought a car. I became a nurse in 2022. I bought a car in 2023, and I paid the car off in 2025 because once I got the car note, I was like, yeah, I don't want this car note anymore. Started traveling, was making really a lot of money traveling, so I just paid it off. We got it out the way. I paid off a majority of my debt. my credit card debts that I have from nursing school, from everything. Because I really want to be debt free by the time that I'm 35. Like, I want all of my student loans paid off, no car note, no nothing, just chilling. The only debt that I want to have is possibly a house. So yes, get your finances in order. I know, like I said, in this economy, it's really hard. Things are going up, pay is not. So yeah, finances. Another piece of advice is that you will lose patience. It really doesn't matter what floor you're on. There was a time that I was working observation, and mind you, observation is you come in, you figure out what's wrong with you. You either go home and handle it outpatient, or you get transferred to a higher level acuity of care. That means nobody should ever be passing away on this floor. And I can't say that's not the case. There's been a couple times where I've walked in and people were, you know, being bagged and tagged, or people were just getting done being coded. So it really doesn't matter what floor you work on. There's a possibility you could lose a patient. Don't carry that with you. I know it's easier said than done, especially when you start to build relationships and build bonds with these people. But it's just a part of nursing. Like, it gets easier. No matter what people say, it does get easier, and it's just it's a part of life too, and it's super sad to see, but I can't tell you like how many patients I've had pass on me. I went in the bathroom, I've thought about it, probably shedded a tear or two, and then you just have to wipe that face off and get back to, like, you know, working like it never happened. It's really sad. It's a lot mentally and emotionally, but just know, like, you're not the only nurse that has ever happened to, especially if you don't work on a higher acuity care unit where you're not used to your patients passing away. Just know, like, it can happen, and don't carry that with you. Like I said, easier said than done, but just try to disassociate. You know? Another thing that I wish that I could just go back and tell myself is that rest is not laziness. When I first started working, like I told you guys, I used to work a lot. Like, I was working my 312s. I was probably picking up a shift or two. I was probably working 16-hour shifts. I still work a lot now, but not like I used to. And resting on your off days is so important. Like sleeping. People ask me the month of March when I first moved down to start the job in the PACU. I literally started the job in the PACU, so I was in orientation then, and I started my travel contract. I literally worked every single day of March except for, I think, maybe 3 or 4 days. And the only thing that I think that truly got me through that was me being able to just sleep after my shifts. Like, I was getting off work at 6:45, going to bed at like 7:38, and doing it all again. That literally is the only thing that saved me. So your rest is super important. Try to build a routine. Like, for me, I'm into the working out, I'm into the eating healthier now, and I feel like that really boosts my energy as well. So my rest and my eating healthy and just relaxing on my days off, like not feeling like I have to do something. Like, there's days I will literally have off and I probably won't even step foot outside just because I'm bed riding all day, and that's okay. You have a very demanding job. You deal with people 24/7. You are dealing with others' issues. Nobody, you know, and I really feel like family members and friends, nobody understands that but you. So it's okay. My phone lives on Do Not Disturb because outside of work, I don't want to be bothered. So some days I will say. But with that being said, yeah, take your rest. It's okay. You're not lazy. You're just tired. You have a demanding job. You're taking care of people. You're listening to a million things. You hear alarms 24/7. You're taking care of family members. You got to deal with management. Like, it's draining. So be sure to rest, guys. There will be days where you feel like you don't know anything, that everyone around you has it figured out, and that you're just lost. I like to call that imposter syndrome. It is very common, especially in new grads, because you're just like, I shouldn't be here educating these people on medications. I shouldn't be educating these people on how to handle things, but you are exactly where you are meant to be. If you weren't meant to be here, you would have never gotten into nursing school. You would have never passed your courses. You would have never made it through clinicals, and you for sure would have never passed the NCLEX or even started this job. So I just tell people all the time, you are exactly where you're meant to be. Even if it feels like it's hard or you want to change careers, or change, not careers, but departments, that is totally fine. But just know nursing is super hard and it's not for everybody, and everybody doesn't make it through. So if you even are able to make it through, pass the NCLEX and start a job, this career is probably for you. And you will literally gain so much out of it outside of just the financial things. So yes, imposter syndrome is very real. There's a lot of times where I'm educating people on like how to use drains, how to take care of things, medication, signs and symptoms, all this stuff. And I'm just like, whoa, me, little old me who probably didn't know a lick of anything about 6 or 7 years ago has all this knowledge now from studying, you know, nursing for 16 months. Like, it's actually very crazy to think, but imposter syndrome is real. You're not impostered. I don't even know if that's a word, but you know what you're doing and you know what you're talking about, so you will be okay. I promise you. And lastly, if I can go back and sit with my younger self, I would never tell her that it was going to be easy, but I would definitely tell her that it is worth it. Nursing school, like I tell you guys all the time, is probably one of the most hardest, humbling things that I've ever had to do, between staying up all night, studying, not being able to hang out with friends, stressing over exams, back and forth driving. Gas was at its peak in the middle of a pandemic. Like, it was hard, guys, but I made it through. It's super worth it. I get to do so many things. I tell people all the time too, like, a bachelor's in science of nursing is one of the most powerful degrees that you can ever hold, in my opinion, because besides being a bedside nurse, there's so many other things you can do. You can get into medical sales, you can become a nurse practitioner, which is just one step below a doctor, but that degree gives you the next step to do that. You can work in anesthesia, you can all types of stuff. You have operating rooms, you have high level acuities, you can do clinics, you can do school nursing, you can do aesthetics. Like, there's so many things that you can do with this Bachelor of Science in Nursing. So I do think it is a very, very powerful degree. I'm super glad that I got it. It is very worth all the money that I spent, and this basically was an investment into me and my life and the things that I want to do. So yes, I do think that younger me is super proud of all the accomplishments and all the things that I've had to go through to get here. Don't let anybody discourage you guys. Don't let anybody tell you that you can't. I can't tell you how many times I've heard professors tell students, like, maybe this isn't for you. Or, you know, clinical instructors. And it's like, who are you to tell me that? Like, you don't know anything about me other than I'm here for class. So go get those degrees, guys. And I promise y'all will be fine. So if this video resonated with you and if you enjoyed it, and if you have any advice that you want to share to your younger self or to new grad nurses or to nurses in general, drop it in the comments. Let's talk about it. But with that being said, thank you guys so much for watching this video and engaging. I will see you guys next week, and I appreciate you guys so much. Goodbye.